We do begin this morning with those new measures that the administration is expected to announce. Our Anjalee Khemlani has been tracking all of this, and probably chief among these new measures, we are going to see a flooding of the U.S. with tests, but not quite yet. Give us the details here, Anjalee.
That's right, Julie. We're going to hear from President Joe Biden around 2:30 Eastern today, and really unfolding that testing plan, which is something that health experts have been very critical of. Right now, what we've heard is that the U.S. is going to purchase 500 million rapid at-home tests, which will be available for Americans to request through a website starting January 2022. So that's really, another sort of complicated way to get free at-home tests, but at least they are free, which is what health experts have been wanting the U.S. government to really do. In addition to that, we also know that 50 million tests will be sent to those that are not privately insured, in addition to the already announced plan for insurance reimbursements for those with private insurance. So altogether, really a lot going on with the testing and the push for at home, as we see just slight delays in turnaround times for PCR testing. We heard from Quest Diagnostics, who said in a statement to me today that they are still seeing a within 1 day turnaround time for those tests. But we know that the lines for those tests continue to increase in recent weeks as Omicron has surged. And that is the reason why the president is also going to be announcing a number of other measures today, including deploying troops to COVID-burdened areas in January and February of next year. Already, response teams have been sent to 6 states. In addition, FEMA will be activated to stand up surge facilities, ambulance, and beds, again in COVID-burdened areas, as well as more plans for vaccinations. We know that right now, the U.S. still lags in vaccinations.
Right, and in boosters in particular, and we've been hearing from the experts that boosters really offer that extra layer of protection against the variant. Also with testing, it seems to me if you have to request the test, by the time you want it, then you got to wait. So maybe you should request that test as soon as you're allowed to, so you have it on hand when you need it. We are also getting more data from the CDC as to how prevalent Omicron now is in the United States.
That's right. The CDC just told us yesterday that 73% of COVID cases are now confirmed Omicron, and that's a significant surge. The Biden administration was really anticipating that Delta would be driving the winter surge, but it appears that Omicron has already taken over and is now the dominant strain. We also heard of the first U.S. death Omicron related in Harris County, Texas yesterday. And that really, going back to our conversation yesterday, Julie, about the severity of the Omicron variant, while it is going to remain largely mild, especially for those who are vaccinated, it does appear that there are going to be those, especially those unvaccinated, that could possibly die. We have started to see the surge in cases, which, as we know throughout the pandemic, there's usually a couple of weeks delay before we start seeing those hospitalizations and deaths. The confirmed case in Texas was an unvaccinated man. And right now, as we know, the number of those who are fully vaccinated, ages 5 and over, is about 65% of those. We also know that 32% of those 18 and older are boosted. So really, as we've heard, from those experts, from Dr. Fauci and others, that the booster shot should be the one that really protects more Americans from getting that Omicron variant in more severe cases. But experts have been saying that regardless of whether or not you're vaccinated or boosted, it's likely we are going to see more cases following what we've seen in the UK with additional deaths, as well as in South Africa. While they have started to see a decline by about 44% in the last 2 weeks, we know that they are reporting an increase in hospitalizations and deaths. So keep an eye out for that.
We will indeed. Anjalee, thank you so much. Appreciate it.